My name is Deborah. I'm 67 years old and I'm from Perth. I was diagnosed at 64, so nearly 3 years ago, with lobular breast cancer, which meant I was lucky that it was found, and it was found so early. But initially it just looked like a shadow and it wasn't going to be anything. And then it turned into it was just going to be a lumpectomy, but in the end I had to have a mastectomy. So I found that very confronting, the idea of a mastectomy. I had the DAP, breast reconstruction, where the fat's taken from the stomach to reconstruct the breast. I wasn't actually offered the reconstruction at the same time, which looking back I'm not sure, it probably would have been better that way. However, because it started just as a shadow and at every stage it increased, after the mastectomy 2 weeks later they decided I then needed an axillary clearance. I then went on to have chemotherapy, and later on I went on to have radiotherapy, and the radiotherapy caused a lot of scarring to the axillary clearance site, and also it made the skin tight and caused rippling because I'd had an implant at the time of the original surgery. So maybe it's just as well I had it in the order I had it. I actually found the notion of having a mastectomy very confronting. I had less problem with the notion of the breast cancer because it was diagnosed early and because West Australians' treatment's so good and I knew the statistics. But the idea of having a mastectomy I found extremely confronting, and my surgeon picked up on that, and she, right from the word go, suggested that at the time of the mastectomy that she'd do an implant because she could see that it was really quite challenging for me, the idea of having a mastectomy. When I decided I wanted to have the surgery, I actually discussed it with my original breast surgeon. We discussed some repairs she could do for the scar tissue around the axillary clearance site, and we also discussed some repairs she could do for the rippling that had resulted after the radiotherapy. But we also discussed that that would mean I'd have to come back and have further surgeries for the implant being replaced over the next couple of years, and also that the repairs possibly weren't going to last for more than a couple of years. Now, at the time, we both decided that I didn't want to have further surgeries. At my age, I didn't want to be coming back in 10 years and having another anaesthetic. So that's why I decided I would go with the full reconstruction. And I took the time to ask her who she recommended. And I think that one of the things that's really important was, for me, I needed to have a relationship with the surgeon that was doing it. So I wanted to know that I could be confident of their skills, but I also wanted to know that I could be confident that they would treat me as an individual, they would understand what it meant to me, and that they would be respectful of my feelings. So she recommended someone who I was very happy with, and I think having found someone like that, I also found that the team around that surgeon were all the same. They all showed me respect, and they were very happy to provide lots of information for me because I needed lots of information. I'm someone that needs to find out everything about it and make an informed decision and feel that I've made the decision, so I live with the consequences of it. So that was an important part of it for me. I was aware, having asked lots of questions and spoken to lots of people, and having a number of family members with medical background, that this was going to be a very big surgery. I hadn't had good reactions to anaesthetics or painkillers when I had the mastectomy, and they'd had to bring extra pain specialists in before I had the axillary clearance. So I was very concerned about how I would come out of the surgery. But I have to say, coming out of the surgery, perhaps because I had a very good anaesthetist and perhaps because I gave him lots of information first, but I came out of the anaesthetic extremely well, much better than the other 2 surgeries, to the point that my son was quite stunned that I was making sense in the same day, whereas the first surgery had taken me 2 days and it had made a lot of sense. And also I found that the pain was far less than I experienced with either of the other 2. I did have access to a pain pump, which I never used at all because I didn't feel the need. And I did have the regular painkillers that were offered to me in hospital. But when I went home, I found very quickly I was just having one at night and not bothering with them during the day. So I think the pain was far less significant with, the reconstruction surgery than it was with either the mastectomy or the axillary clearance. After the surgery, I was actually in the ICU an extra day, and it was explained to me that you were only going to ICU so that they could have regular obs, and that was good. But because I have trouble with blood pressure after anaesthetic, I was in there an extra day, and I did have a bit of trouble with the blood pressure. But I found once I went up into the ward, people were very good at helping me with movement. There were restrictions. I think I was in some ways lucky because with an occupational therapy background I knew how to move correctly, so I wasn't putting pressure on the scar across my stomach, and I knew how to ask for help with certain things. So yes, it was restrictive, but I would think that it's very important that people have it clearly explained to them, the process for getting out of bed, so you're not just sitting up and putting all this pressure on the new scar. But with that, and moving around with the big trolley that you had to have with all the drips and everything attached was a bit cumbersome, but I don't think any of it was, unmanageable. It was as I'd expected, if anything, again, a bit less than I'd expected. To date, I haven't had any revision surgeries. I'm actually 6 months since the original surgery. When I first had it done, because I was so pleased with the result, my initial thought was that I wouldn't have any revision surgeries. However, when I went back for one of my recent appointments with the surgeon, he explained what would be involved in the revision surgery, and because it's a relatively minor surgery and I will only have to be in hospital overnight, and I could even go home on that day, I came to the decision that I got this far. I wanted it all to be done at once. The revision surgeries I'm having are fairly minor because it's such a good job in the first place. But I thought, well, for me, the reason I needed the reconstruction was because I needed to be able to put the breast cancer behind me, and I didn't want to get out of the shower in the morning and look at, huge scars and things that look different. So I might as well go the extra step. So that I could feel that the whole process was done and I'd never have to go back there again. I'm 6 months since I had the original surgery. I'm still doing my exercises as prescribed by my physio because, again, being an occupational therapist and having a rehab background, all the way through I've done all my exercises and followed all the advice because I know it makes a big difference to the outcome. So there's still some exercises I'm doing. I'm still wearing lighter support for the scar around my stomach. I don't have to wear the compression garments I had originally, but I'm feeling good, and I find that that's a really minor restriction to wear the support garment. And I also find that it's become part of my daily routine to spend 5 minutes doing the exercise while the kettle's boiling and I'm making my cup of tea and it's brewing. So it's not really been much of a restriction. So I'm very happy with where I'm at now. My advice would be, for me it was important that breast cancer didn't define me and the whole experience didn't define me. So I wanted to keep my life as normal as possible. For me, it's been a bit of a struggle to actually accept that I have to slow down a little bit, and there's some things I can't do. It's not my personality, but I think that, that's something that you have to do. But beyond that, I would say keep active, keep involved, do all the things that are prescribed, do your physio exercises, do your scar massage and put your creams on, because you've put a lot of effort into this far and you really want the best result. So if you want to put this behind you and get the best possible result, follow the advice. I'm very happy with the results so far, and as I say, there's one more step to finalise it, so I don't know quite. That'll be the icing on the cake and I'll really know how I feel then. But I am not someone, I've never been very happy about surgeries. I've avoided them all my life. The idea of a knife going into my body and, damaging it in any way has always been a big phobia. So I think, it was a big step for me to acknowledge that I wanted to do the surgeries, but I'm very glad I have now because I feel that it makes me feel more like me again and less defined by the whole process. So I think it's been very worthwhile.